was talking about common complaints are pregnant women always lodge or always faces, which comes as a result of what? The pregnancy. So I mentioned the common complaints and then I'm coming to take them one after the other and then the management given to it. When we take morning sickness, it is this excessive vomiting, morning sickness, this frequent and excessive vomiting. You know, a pregnant woman vomiting frequently and excessive like that, the person is losing water, and by the time you realize, the person becomes dehydrated. So a pregnant woman vomiting frequently like that, sometimes you don't just sit down in the house. You need to go to the hospital and lodge the complaint because as you are vomiting, it means you can't take anything oral. Once you are vomiting, anything you take, you bring it out. Anything you take, you bring it out. It means that you have to be giving something through the vein. So if we are to hydrate you, we don't know you are in the house vomiting. So you only report in the hospital and tell us that you are vomiting. So our way of hydrating you is to secure IV line for you and then hydrate you with what? IV fluid. So that is why it is always advisable to report to the health facility if you are experiencing this morning sickness. So experiencing morning sickness, what are some of the things you got to do as a pregnant woman? You need to eat small but frequent meal, okay? You have to take in dry carbohydrate snacks throughout the day. You also need to take rest. You also have to keep well hydrated with water and then wear comfortable clothing. These are some of the things you should do if you are experiencing morning sickness. Some of us is to we the health professionals management. Then there are some that is left for the pregnant woman to do. That is wearing comfortable clothing, hydrating yourself. Sometimes hydrating yourself. If vomiting, you can still tolerate water. You need to take in more water as well. So that is about the morning sickness. The constipation, okay. Constipation is also a common complaint in pregnancy, which also comes as a result of pregnancy. Okay, so when you are experiencing constipation as a pregnant woman, what do? You eat food high in what? Fiber, and then fruits, that is wholesome bread, a wholesome meal. Okay, so let's look at what else can a pregnant woman do when she's experiencing constipation. She needs to do regular exercise. We saying a pregnant woman should do regular exercise doesn't mean that you should go and involve yourself in a tedious work, carrying heavy load, and at this and that. A pregnant woman, you can just be taking a walk. Okay, walking will help you also involve yourself with this scheduled exercise, and then you be sweeping your house with this local standing broom will help. Okay, sweeping is just like you're not bending but you are standing but you are taking a walk as you are sweeping. You also need to drink plenty water. Okay, without water digestion wouldn't take place. So I said that what? Taking food rich in fiber and then fruit. Okay, food rich in fiber, that is fruits. All fruit helps to soften your fecals, okay, and also do regular exercise and then drink plenty water. That is the constipation. So for the skin changes and the rashes, these are normal changes that occurs during pregnancy, okay? And these changes are termed physiological and it is due to the pregnancy, okay? You see some pregnant women, by the time you realize there is this stretch mark on their tummy, it's because of the growing uterus. Once the baby is becoming big, everything, your skin, it's stretching, making those things appearing on your body. That is the hyperpigmentation that we are talking about. You also see a darkened line running from the north to the south pole of the pregnancy. That is the linea nigra we are talking about. Okay, these are some of the changes the pregnant woman faces during pregnancy. Let's also look at the swollen ankle and then the feet. Swollen ankle, feet, and fingers. What are some of the management you can give to this swollen ankle, feet, and finger? The pregnant woman just need to avoid standing for a long period of time. She needs to also wear comfortable shoes, putting feet up as much as she can. Okay, you have to put your feet up. Okay, you have to do foot exercise as well. This is what will help your swollen ankle, feet, and finger to go back to normal. Okay, so these are the managements you need to do if you are experiencing that as a pregnant woman, swollen ankle, feet, and finger. Let's look at the varicose vein. A pregnant woman having varicose vein, we encourage the pregnant woman to avoid standing for long. She should try not to sit with a leg crossed. She should also not to put too much. She should also try as much not to put on too much weight. She should also sit with legs up to ease discomfort, and then also sleep with legs higher than the body. So these are the things you should do when you are experiencing these changes in pregnancy. We've just mentioned some things, basic things to you for you to do to get that relief. Okay, I hope you are enjoying my video, and please encourage someone to also come and learn something in this video concerning antenatal care and antenatal management. Until then, I'll see you in some other video with an interesting things you need to know.